Tonight's special segment, Sleeping Soundly. Millions of Americans do not get a good night's sleep. Snoring and sleep apnea are the most common problems. Now, a simple procedure performed in the doctor's office is offering a cure. ABC7's Sylvia Perez is here to explain just how it works. Sylvia?
Cheryl, imagine if you stopped breathing hundreds of times a night while you are asleep. The problem is called obstructive sleep apnea. Many people who have it wear a cumbersome sleep device to deal with it. But now there's an alternative treatment that could eliminate the need not only for that breathing machine, but for risky surgeries as well. To the onlooker, this noisy bedroom scene may seem funny, but for those dealing with the snoring and the sleep apnea that come with it, this situation is nothing short of a nightmare. Tom DeHaan knows firsthand.
Sometimes it gets a little tough to stay awake at meetings sometimes, and you know, not as energetic as I used to be. Makes the day go along.
Tom has sleep apnea, and like many others with the disorder, he uses this odd-looking device called the CPAP to help force air down his throat while he sleeps. Sleep apnea can be caused by a blockage of the airway when the soft tissue in the back of the throat collapses and closes during sleep. CPAP is very effective, but given a choice, most people would prefer to ditch the machine.
You know, when you wear this thing, it's like wearing a Halloween costume every night.
The alternative could be these 3 little inserts. They are part of the pillar procedure, a technique recently approved by the Food and Drug Administration to treat obstructive sleep apnea.
We found that it is very effective for the right patient in improving mild to moderate sleep apnea.
The procedure takes just a couple of minutes, and it's all done in the doctor's office. Here's how it works. A patient's throat is numbed. Then the 3 inserts are injected into the soft palate. The area that was once floppy stiffens, allowing air to flow more freely when the patient is lying down. The inserts are made from a soft polyester material that has been used for many years in other medical procedures.
Basically, it creates scar tissue and stiffens the tissue itself. It gets incorporated into the tissue, just as a suture would if we were suturing in surgery.
Dr. Michael Friedman at Advocate Illinois Masonic Hospital has been using the pillar procedure to conquer snoring for the past 1.5 years. His research also shows it is effective at helping sleep apnea. Elizabeth Zydron got the implants about 6 weeks ago. She says between her snoring and sleep apnea, she would wake up several times a night. Now she is sleeping soundly.
This went so smoothly. I have no complaints. And of course the result is great.
Sleep apnea is a very complex problem that can involve several different areas of the body. Some patients may have to couple this procedure with sinus surgery. Tom DeHaan says this was an easy first step in his treatment process.
Hopefully this will do the trick.
Dr. Friedman says in his study of 125 patients, the cure rate using the pillar procedure was about 40%. That is comparable to traditional surgery, which is much more complex. Again, this procedure is not for those patients with severe sleep apnea. Doctors say it works only on mild to moderate cases. And Cheryl and Kathy, the cost is about $2,000, and in most cases it will be covered by your insurance plan. But imagine the alternative, that big machine or having these in your throat.
A lot of people will be interested in this one.
Absolutely.
All right, thank you, Sylvia.
Thanks, Sylvia.